So nursing unions are calling on the Eastern Cape Health Department to assist in protecting staff. The province has seen an increase in violent crimes in clinics as well as hospitals. Just recently, a security guard was shot and killed by suspects who robbed a health facility of 5 computers. Yesterday, we spoke to the National Union of Public Service and Allied Workers, Mzikazi Nkata, who shared concerns around the safety of staff. Let's now bring in the Acting Deputy Director General for Clinical Services in the Eastern Cape, Dr. Mthandeki Xamlashe, who's now joining us live. Dr. Xamlashe, good morning. Thank you so much for making time for us. From your understanding and the reports that your office has been receiving, what is happening in the province?
We are in big trouble in the province, and perhaps from media reports, the whole country. Our health establishment and health facilities and even health services like your ambulance crews are beginning and are suffering, the general wave of crime that is actually engulfing our communities. We are, as a department, very much concerned as we are now unable to discharge fully, the Section 27 obligation that compels us to provide easy access to affordable health services to our citizens. Now, crime is beginning now to get into the area and into our operations, and it's affecting us adversely. The attack on our security guard at the clinic is of grave concern, because as an employer, we are obliged by OHS Act to provide safe working environment for all our personnel, doctors, nurses, even security guards. And our security systems, do not allow us to provide armed guards who are a gun-free environment. And therefore, in terms of defense, we have certain serious limitations, and we purely depend on law enforcement agents like South African Police Services.
Do you know how many facilities have been robbed since the start of the month, whether it is the hospitals or clinics?
Certainly more than 20. That's the range we're looking at. And these kinds of incidents, adverse incidents, were much more common in the Gqeberha area, where it almost is a daily experience for our personnel and staff, to get caught in the gunfires between various gangsters who actually, some of them ran to our facilities for treatment. And obviously their rivals would come in to try and finish them off, either in our clinics or our hospitals. This is a very common experience in the Gqeberha area.
Well, 20 is a huge number, Doc.
It is a huge number because these incidents range from gun violence, to knife attacks or to hijacking or people coming in to rob, our staff and patients of their own belongings. These are happening very commonly. Our district managers will tell you these experiences. And it's unfortunate because our patients are our treasure and our staff are our treasure. Without those tools, we cannot exist. We have invested a lot of money, almost 790 million, on our security systems, which obviously operating in a gun-free zone. And there's a limit to what we can do. We must obviously acknowledge the support we do get from the security cluster. That is from our South African Police Services, who are always available to assist us. But ultimately, this is a societal issue. We do know that when society makes a decision, like the society of Mthandeki Township, one of the biggest townships in the country, if they make a decision to protect their facilities, these incidents drop by 90%. We have a case in point, which is the Mthandeki Township in the BCM area. These incidents only dropped when the society and community took a stand and a decision to protect their health facilities. Until that happens, we remain exposed, and to be served by an anxious healthcare provider is not the best for any citizen.
Yesterday, as we said in the introduction, we were in conversation with Mzikazi Nkata from the National Union of Public Service and Allied Workers. She alleges that the department has taken a decision to reduce the deployment of security officers at the various health facilities. Can you confirm this?
We may have different sources of information. Our documents do not show that. We have not done that. If anything, it's the opposite. we are increasing the number of guards in certain areas. But that be as it may be, it may not necessarily improve, our security, because it's not in the numbers, it's in the sophistication of crime that we are confronted with. We are deploying electronic security systems, surveillance cameras in our facilities. But sometimes those are not sufficient deterrents to the criminals, who are hell-bent to get what they want at whatever cost, even the cost of a life. And at this point, I must convey condolences to the family, of the security guards that was shot dead in our own facility.
Yeah. So you're saying that according to your information, it is not true that security guards are being reduced at the various facilities. But do you think having 2 security officers at a clinic is enough?
Look, Adrian, I want to keep repeating this. Our security is not in the numbers of security guards. I want this to be understood. These robberies happen even when you have 20 guards. It happened at the Livingston Tertiary Hospital, in a particular administration department. And at that given point in time, they had 64 guards on the shift. So our security is not in the numbers. It's in the posture and the resolve of communities that are willing to protect their facilities. Having 3 guards in a particular facility, a small clinic, yes, to a certain extent, it may well be a deterrent, to that petty criminal who just wants to jump a fence and steal a copper fence. That we are doing because our numbers of security guards actually have gone up by more than 50% in the last 5 years. And our bill shows it, are coming from 300 million to 790 million. That is the payroll of security guards. So that alone is evidence enough. That's why I'm saying maybe I may differ with the other person you spoke to in terms of sources of documents.
Yep.
We have evidence to this effect. Yeah.
Does that then mean that perhaps maybe you may have to change regulation as well in terms of security officers not being allowed to carry firearms at health facilities, considering as you speak about the sophistication of the crime as well? Because these thugs go to these health facilities knowing very well that once they get there, they're going to find a security guard with a baton maybe.
Yes, Adrian, ideally you would want to do that, but that is a terrain of South African Police Service. When you're talking about armed security and armed safety for our communities, that is certainly not the terrain of the Department of Health. Unless people say then the South African Police Service must take then control of security, total control of security of our facilities. We are not in any position to arm our guards, and we will never do that.
Yeah,
because by the very nature of our environment, we cannot actually allow firearms in our facilities.
Okay, so you're saying that because of that, you're not going to allow firearms at the facilities?
No. A lot of incidents happen there that may be related to the illness of a patient, whether it's a mentally ill patient, and that may really cause havoc if there's firearms involved within our security.
Then what's the solution? What's the solution outside of depending on community members to protect the facilities?
Believe you me, there's no other.
There's no other.
COVID was a good example. During the COVID era, there was hardly a single attack on our facilities because the government took a stand through the Disaster Management Act, and it was controlling the taverns, it was controlling, the open events that were happening, and it was reducing the levels of alcoholism, and crime was under control. That's a good evidence where the regulation can make an impact. The other one is the case I've just cited. In Tanzania community, the incidents have dropped by 80%. Because the community made a decision and took a stand to work with the law enforcement agents to protect the health facilities. That is happening. So we depend on the stand of the communities working with the law enforcement agencies. And there's no other way.
Acting DDG, don't you run the risk also of health workers eventually deciding to withhold their services? Because as you said a bit earlier on as well, that you have a duty according to the Occupational and Health Act of the country, Occupational Health and Safety Act of the country, to ensure that workers are actually safe.
No, we are not folding our arms or sitting back. We're doing a lot, Aldrin, to make sure our staff and assets are safe. We are working with South African Police Service who are even working with correctional services, even the South African Military Services, South African National Defence Force, sorry. We are working with them. You know, we have a security cluster, and our community safety department in the province is leading that intervention. So there's a myriad of strategies that are in place to make sure we continue to improve the situation to protect the lives. We can never renege on that obligation to protect our workforce. And it's important, but we are also highlighting the role of the communities and society in general.
Thank you so much for your time. The Acting Deputy Director General there for Clinical Services in the Eastern Cape, Dr. Mthandeki. Xamlashe, what do you make of what he has expressed there, that unfortunately the only option that is available to them now is through legislation or having communities protect those facilities?